What's cooking with Nori?
And applying it to your in the middle, like at night while. Oh no, the eyelashes are
Violently.
Yeah, you don't want to many rubber with human hands. There's so much sensitive. There's no bone.
But the reason
Scars. It's looks like pretty. So the whites of her eyes. This have nevoid syndrome. Some oil, put it on me. You got out beyond belief. Otherwise,
A serious case of dermatitis and
it's like about 36 hours. You will die. Tendon sheaths, the joint. Your bacteria out there. Like Google.
You know what these people think? What's cooking boys up vanilla pepper can with another video. No, it is not too much to say. Today I reaction a video on TikTok skins. So like that do people will be doing crazy things on TikTok just to get likes and things. No, it is. If you're new to the channel, don't forget to hit subscribe button with the notification bell that you can be notified when someone has a video. No, it is. Welcome back to my subscribers and let's just get to the video.
Skin TikTok sometimes makes me want to pull my hair and skin out. Skin off? But there may be some good hacks in there, so let's check those out. Huge thanks to Bioderma for sponsoring this video. Let's get started. Have you tried slugging? Oh yeah, people love this.
What the heck?
People love it. It's actually one of the more benign treatments that I've seen on the TikTok sphere. You can certainly overdo it, but the value here is using a petroleum-based jelly and applying it to your skin, especially during winter time. If you have really, really dry skin, it's essentially a occlusive type of jelly where it blocks dryness, so it blocks evaporation of fluids from your skin, keeps it more moist. Just remember, a little goes a long way. Don't overdo it, and make sure if you're doing this in the middle, like at night while you're sleeping, you wake up and you wash it off first thing in the morning. I didn't remove my eyelashes before my facial. Oh no. Oh no. Oh no, the eyelashes are gone. I mean, they would have come off in that same way either way, so I guess it's not that big of a deal.
I used to wash my face so violently.
Yeah, you don't want to wash your face too violently. That can actually lead to more inflammation because you want to take off the superficial, dry, dead skin, but you don't want to overly rub because rubbing creates friction, it creates heat. It actually encourages your body to release inflammatory markers to stimulate inflammation.
I used to be like a dude. Have you seen men wash their faces?
Actually, I haven't because most men don't wash their faces.
this is the weirdest sport ever.
What is this?
What you trying to say?
It's called nose pulling.
Is this similar to like where they take watermelon and they see how many rubber bands they can get around it, but they replaced watermelon with human hands?
Two participants are tied together by a rope around their faces, and they have to push as hard as possible to...
There's so much sensitive cartilage there. Look, there's no bone.
But the reason behind this game will shock you.
There should be no reason to play this game.
This game was created to make players stronger and better at dealing with pain.
I mean, there's got to be a better way.
Would you dare to try this?
No, don't try it. Don't dare. You're gonna damage your face. You're gonna leave long-lasting scars. It's so bad. Like a cut can heal, but like pressure wounds like that, they can be so debilitating that they don't heal well and you scar terribly. Oh, we got, looks like burns. Looks like pretty significant. Oh, it's a sunburn. Oh, I can feel the pain through the screen. You know, putting that saran wrap, the cling plastic, actually could be beneficial as long as you do it after you run cool water over a burn. Some of the best wound centers in the world actually do that. They tell you to run cold water. Running cold water, not just putting cold water on it, smart, because then the water continues decreasing the temperature and removing the heat from the area. You don't want to put ice. You don't want to go from one extreme to another extreme because ice can also damage skin tissue. And then actually covering your skin with that kind of saran wrap protects the superficial nerve fibers that actually cause pain, and you feel pain because they're uncovered. But if you cover them with that saran wrap, that could decrease some of that pain. Don't keep it occluded long term and allow it to breathe every now and then, and obviously discuss with your doctor, but it is something that is recommended in some wound centers. Whoa!
Who's it for coming in?
What the heck?
They definitely did something to it. They hijacked it.
That's some serious hand sanitizer.
That's not how hand sanitizer is supposed to work. Although proper hand sanitizer has an alcohol content higher than 70%, and in those situations, it is highly flammable. When everyone tells you you're glowing during pregnancy, wait, It turns out
Why
that
is
it
she
was
looking
jaundice
like
from
how-
liver failure. All right, for those who don't know, you could actually turn yellow. Skin does turn yellow, and jaundice is the medical term for that. And it's not just the skin, notice it's also the whites of her eyes. This happens for usually one of a few reasons. Most commonly, it's some kind of excess breakdown of red blood cells, and bilirubin, the breakdown product of that, starts building up and actually seeping into the subcutaneous tissue. Another way it can happen is if the liver starts failing due to a virus, due to a blockage, due to some direct liver injury. Curious what happened in this case. Okay, I see an NG tube, which means that they're sucking contents out of her stomach, which could be to prep her for emergent surgery, or in unique cases, jaundice can be caused by issues not just with the liver, but also the gallbladder and or the pancreas. Do we know what? We don't know. Okay, I guess we don't know. I wonder, with pregnancy, most common cause? Interesting, acute hepatitis, specifically viral hepatitis. Interesting. BTS versus the shots. The flex is real. Oh, maybe some skin discoloration? Okay. All right, this is some kind of nevoid syndrome. When we say nevoid, these are like melanosis, melanotic spots where you have excess melanin production. And now in a lot of cases, this could be benign, and it's important to work with the dermatologist just to confirm that. It happens really early, like right after birth, and then it continues, but then it stops. It really depends on which specific condition it is.
Did you know if you mix baking soda with honey and apple cider vinegar,
You get a super potion!
mix it until it's like a paste, and boom, you got the best homemade natural remedy for pimples. Just put some on your finger.
I feel like people are just putting anything on pimples now. You got some oil? Put it on me. You got some apple cider vinegar, honey, baking soda? Throw it on my face.
Leave it on overnight and it'll disappear.
Or use benzoyl peroxide, which is a medically approved treatment for pimples, and it will also work a huge majority of the time.
IDC nothing takes off makeup better than dish soap.
I mean, there's some other products
What's that?
like the micellar water from Bioderma that takes off products a lot better than that. And why I say a lot better is because dish soap is a degreaser. It's meant to literally melt oils off of pantry. You are not pantry. Your face is meant to have some oil. Oh man, oil is protective for your face. You don't want to completely like dry it out beyond belief. Otherwise, see the problem with humans, and it's not really a problem, it's actually a beautiful situation with humans, where you need a good balance of things. Like, it's not about having acidic pH or basic pH, it's just having the right amount. It's not about having no oil in your face or too much oil in your face. It's about that right balance. When you use dish soap, you throw that balance out of whack. Actually, this is the perfect opportunity to discuss my long-standing partner, Bioderma, who makes the micellar water makeup remover I just mentioned. You see, Bioderma created micellar water in the 90s without irritating down in the skin. As all skin is not the same. For those who do, their social channels for skincare tips and tricks that actually make a difference. All right, let's get back to the video.
Paul Harrison wasn't always blue, but in 1993 he saw an ad in a magazine
Oh no, it's just colloidal silver?
for a colloidal silver generator.
No.
Paul figured it could probably cure his acid reflux if he drank it, so he drank 10 ounces a day.
Oh my God, this actually is real. Drinking enough colloidal silver can turn you blue.
He then began to suffer from a serious case of dermatitis and figured colloidal silver could cure that too, so he began rubbing it on his skin.
Your eyes can even turn blue.
Paul finally realized
What
he
the-
had turned himself blue.
Look, there are no medical uses for colloidal silver. The National Institute of Health has this website for complementary and integrative research where they try and find unique avenues for natural remedies to be incorporated into evidence-based medicine. And even on their website, they're like, nope, dangerous, no reported medical uses, do not use. So please, please don't do this kind of stuff.
Lost boy returns.
Oh,
to
this is the
village
fake
with
thing.
1,000
This is
ticks.
so fake. I've seen this. These are literally beans. These are not ticks. No, this is BS. You could see the adhesive. These ticks, and that's first of all not even how you remove ticks. Here's a proper diagram from the CDC. You want to try and remove them straight out and grab as close as you can to the skin. The most important thing when it comes to ticks is limiting the amount of time that they stay attached. It really takes like about 36 hours for a tick to be attached and for it to have the bacteria that causes Lyme disease to be transferred, because actually that bacteria lives in the gut of the tick. So it actually starts needing to salivate and percolate your blood through it in order for it to infect you with it. So So getting it off as quickly as possible is important. Seeing your doctor. Some people ask if they should test what tick it is, and there's some labs that do this. Bring it with you if you have it to your doctor's visit. We can identify if it's the type of tick that actually spreads Lyme disease.
This is what happens when you go to a dirty
Okay,
barber that
imagine
doesn't
going
clean
to
their
the doctor
tools.
with
That's
a
called
tick here.
tinea capitis. That does happen.
You get ringworm all over your head.
Ringworm is kind of a catch-all term. Really, the way we name these conditions is based on the body part, and usually the type of fungus that's involved is the type of tinea. So if you have tinea on the head, tinea capitis. If you have on the body, tinea corporis. If you have it in your groin, it's tinea cruris. We have specific antifungal shampoos and creams for these things.
If you step on a rusty nail, you'll get tetanus.
You won't definitely get tetanus. And first of all, I hope you have work-safe shoes that actually prevent that from happening.
And die. To prevent this, whenever you see a rusty nail sticking out of a board,
you will die. I hope not.
with the nail removed, we can reinsert a new clean nail back into the board.
But then you don't need to flip it over.
Now,
so someone
we
step
can
on
safely step on this nail and not have to worry about getting tetanus.
it. No, we get tetanus shots as a prevention for this. The way we treat patients that come in with what we call a dirty wound that is tetanus susceptible
guy is
is make sure
speaking
their
like-
vaccine is up
no,
to date.
wait.
No, we get tetanus shots as a prevention for.
Like, okay, imagine like you hit that thing out and then you put it back and then you tell the people they can step on it. Imagine if kids watch the channel of him. And then kids will do that thing and then they step on it and then they get hit.
This. The way we
A lot of
treat
people
patients
don't
that come
think for
in
the
with what
kids.
we call a dirty wound that is tetanus susceptible is to make sure their vaccine is up to date. Sometimes we use the immune globulin of tetanus. It's really depending on what the wound looks like and how long it's been since your last vaccination.
If you have herpes of any flavor,
I didn't know herpes came in flavors. He talks about it like a soft
Some
drink.
flavor.
or if you have shingles or chickenpox, these are lipid encapsulated viruses, and a synthetic oil antioxidant called BHT that you can buy for pennies on the dollar will absolutely fix all of these
Unfortunately, no, it won't because it's an internal problem.
because it blocks viruses' ability to replicate.
So again, you take something that happens in a petri dish and you think that it works in humans, but that's not how life or science work. That's like saying, look, fire disinfects bacteria in a petri dish. Yes. Do I want to swallow fire when I have a sore throat? No, right? That's not how it works.
Use peppermint oil if you have a headache. Use tea tree oil if you have acne.
Okay, look. I'm going to let him finish.
Use rosemary oil if you have hair loss.
Hair loss.
Use orange oil if you want to clean your house.
Oh, wait.
Use clary sage if you want to
Clear the spirits.
relax. And use chamomile oil if you want to sleep better.
All those things are so harmless if you do them in small amounts, and they're for conditions that aren't necessarily life or death. So I'm not gonna badmouth that video. I will just say that the evidence on all of those is almost non-existent, with the exception of like tea tree oil for acne. It has some like a modicum. I never use that word. It's such a nice word, a modicum of evidence for it, but it's like not the
What's the
greatest
meaning
level
of
of
that?
evidence. So if you have like mild acne and you want to try something, you could try tea tree oil, but like I don't recommend it for a sign. Like I don't understand. There are things that are proven to work, and not all of them work all the time.
Yeah.
That's why we have first line, second line, third line treatments. But we know that they work, and we also know their side effects. But then people are like, nah, I'd prefer to go with the thing that doesn't have the evidence that it works. Why? Why?
Ooh, bad thing about woodworking.
Ooh, splinter. Oh, I feel it. I feel a splinter coming. Oh, it's gonna be deep, and it's in a bad place. It's in a bad place. It's in the finger. Is it in the joint? Oh my God.
That's a good one.
Oh, the angle.
Oh yeah.
Oh man, I would not have done this myself. I would have went to an ER and had a hand surgeon look at this. There's too many vital organs there. Nerves, tendons, tendon sheaths. The joint can get infected. You get a septic arthritis. Oh boy.
Wow, that didn't feel good at all.
No, it didn't. Not for me either. God, and his hands are still dirty. At least wash your hands before you do it.
Urine is the #1 anti-aging resource as far as I'm concerned. Urea is the only clinically proven skin moisturizer in the
What? Thank you for showing me his name. I'd be more interested with an arrow and where this knowledge is coming from.
Urea is it's urine. So
Your skin looks amazing.
First of all, urea is not urine. Urea is in urine.
it absorbs right away. Any objection would be, is your face going to smell? You can smell my face.
Prefer not to.
You can wash it off after 10 minutes, but you don't need to.
Because it doesn't do anything.
Because it's already absorbed.
It's literally a waste product, and he's like, put it on your face. Look, fetish is an okay human thing, but don't make it out to be medical advice.
I'm gonna do a
People have like a lot of things like to destroy
So I'm
like
taking sand and salt water.
pimples and things.
Oh, that's a little aggressive.
Scrub it all over the face. The sand is made of quartz and minerals, so I just feel like, I don't know, I feel like it's good for you.
Nothing terrible is gonna come as a result of that. Probably. I mean, I don't know what kind of bacteria is floating on in that ocean, because there are some pretty savage bacteria out there. Like Google Vibrio vulnificus. Well, maybe don't, because that's gonna freak you out. But we have products for this. Here's the dark side of cosmetic procedures done at med spas. Click here to check that out, to hear Bia's story, and as always, stay happy and healthy.
Thank you for watching.
You know what it is, people? Thank you for watching the video with me. So for everybody to pick it another video. You know what it is, don't forget to like and share, subscribe. Bam, outside.
Wake up for the bag, nigga, expand. Went to school, got that nigga, expand. Got a job, nigga, mara, expand.